The coronavirus pandemic is the latest infectious disease to emerge from human interaction with animals. This intersection isn't just limited to wildlife wet markets, but also through urban land clearing, agricultural development and globalised travel.
Now, scientists are now warning that as animal habitat and the environment continues to decline, the number of pandemics will continue to increase. Fiona Armstrong is the Executive Director of the Climate and Health Alliance, and she says it is time to link public health with environmental policy. She joins us now on the show. Welcome to the show, Fiona.
Good morning, Fawzia.
We can obviously see the link between climate change and our environment, but it isn't often that we see that link, that very clear link between the decline of the environment and our health. So just explain that to us.
Sure. Well, our health is actually entirely dependent on a healthy natural environment. I mean, the natural world provides everything that we rely on for our health and well-being, but actually for, to live and survive. So clean air, soil, water, food and fibre. Natural ecosystems regulate the climate, and they also help protect us from pests and diseases. And they provide us with about 50% of all medicines.
And how is it then that a declining environment would lead to an increase in infectious diseases globally?
Well, if we're destroying the natural environment, we're destroying those foundations for human health and well-being in a way. So one of the things that we've seen with the rise of pandemics and diseases jumping from animals to humans in recent years is that we are encroaching on the natural world. So when we clear forests, when we expand urban developments, when we go into regions where humans haven't been before, we're putting those ecosystems and the other species that exist there at risk. So that causes declining health for other species, and it means that we're putting ourselves in a position where those diseases jump more readily from animals to humans. So this kind of disease where zoonoses, which transfers for animals to humans, has been increasing, and that's what we're seeing with the COVID-19 pandemic.
Now, as a result of all of this, of course, your study, you're advocating for the government to apply, and I'm going to quote you here, a health lens to its climate policy. What does that entail? What would that look like?
Well, people in the audience would be familiar with, many of the ways in which climate change affects public health, or they may not be aware of those links, but they would recognise, I think, that climate change in the form of heat waves and bushfires, the choking air pollution that we've seen recently, can have very significant effects on public health and lead to deaths. The choking air pollution that blanketed Australia last summer, over 400 people died. So what we're saying is when we're making decisions about climate policy, or in fact any policy, we need to be considering what the implications are for health. It's really a nonsense to be considering policy in silos because everything is interconnected. So when we're making decisions about energy policy, for example, one of the most important areas in which we can make decisions in order to tackle climate change, if we were considering health in the context of that, we wouldn't be choosing coal, for example. Coal drives climate change. It also causes local and immediate health impacts in the form of pollution. So applying a health lens, that means looking at what are the implications for health for the decisions that we make across a range of policy areas, and making sure that we make decisions so we don't have unintended consequences for health down the track.
All right. Well, some climate skeptics will say that you're using health as a means to further your cause against the fossil fuel industry. What do you say to that?
Well, the Director General of the World Health Organization has declared climate change a health emergency. Every major medical and public health journal over the last several decades has been documenting the health impacts of climate change. And I think people are beginning to understand that link because they're feeling those impacts themselves. The reality is that climate denial is funded by those who have a vested interest in the status quo. There's well-established techniques that corporations have used to sow doubt about science for decades. The tobacco industry wrote the playbook. The fossil fuel companies have just updated it and added a few chapters.
Just moving on to something else and away from the fossil fuel industry, an IAEA report says that it expects that the carbon emissions during this global lockdown will fall by a record 8%. What does this actually mean for our biodiversity? Is this going to help regenerate, regrowth biodiversity that may have declined?
Look, I think what we're seeing is a temporary improvement in air quality and, as you say, a drop in emissions. Unfortunately, though, the climate system, there's a lag in the response to that. So we really need to see a drop in emissions over several decades for us to see any dramatic improvement. So there's lots of policies that we can enact to protect biodiversity, and those are both local in terms of tackling deforestation and so on. But in order to tackle those pressures on biodiversity from climate change, we need to invest in cleaner energies, all of the things that we know will reduce emissions in the longer term, because those pressures need to be eased, and the emissions reductions have to be sustained over a very long period in order for the climate to respond.
Fiona Armstrong, thank you so much for sharing your insight with us.
Pleasure. Thank you.